This is a model of your larynx. The larynx is a multi-structured organ within the vocal tract that serves as the passageway between the upper and lower airway. The larynx acts as a sphincter that closes to protect the airway, and it also opens to aid in breathing, and it serves as a sound source for phonation. So your cricoid cartilage, which is this dark blue piece that's wrapped around, it is made up of hyaline tissue, and it connects to the thyroid cartilage, which is the light blue piece. It connects via the inferior horns. This cricoid joint allows the thyroid to rotate anteriorly and posteriorly on the cricoid cartilage. Your hyaline tissue is flexible and elastic. It is made up of collagen. It forms the thyroid, cricoid, and arytenoid cartilages, and it ossifies with age. And then your elastic tissue is similar to the hyaline cartilage, and it does not ossify with age, and it helps form the epiglottis, which is this little pink piece. Your thyroid cartilage, which is the light blue piece, it is the largest unpaired cartilage in the laryngeal framework, and it is also known as the Adam's apple. So it's wider in females, and it's more narrow and acute in males. So that's what really forms the little notch in your throat. So it's more prominent in men. And then your arytenoid cartilages, which are these dark blue triangles. They are paired and consist of hyaline and elastic tissue, which we just talked about, and has two main processes, which are vocal processes and muscular processes. The arytenoid cartilages also serve as the posterior attachment for the false vocal folds. The arytenoids are connected to the epiglottis by a muscle called the aryepiglottic muscle or fold, and to the thyroid cartilage by the vocal ligament. So your false vocal folds, which aren't seen in here, they sit superior and lateral to the true vocal folds and play a minimal role in pitch, but they play a major role in preventing invasion of pathogenic agents. So your arytenoid, these little guys right here, they allow movement, your abduction and adduction, which abduction is the opening of your vocal folds and adduction is the closing of your vocal folds. So your epiglottis, which is the pink piece, it is the superior part of the larynx. It is located posterior to the hyoid bone and base of the tongue. It kind of looks like, some people mistake it for a tongue because that's what it kind of looks like. But it looks like a leaf in shape, so it's more broad at its top and more narrow at the base, and it is composed of elastic cartilage. So your hyoid bone, tongue twister, is this red piece. It is the site for the muscular attachments of the larynx via the suprahyoid and the infrahyoid. There is no attachment to other bones, and it is attached to the tongue via a ligament called the glossio-epiglottic ligament. So your intrinsic laryngeal muscles, they are responsible for the movements of the laryngeal cartilages and finer control of the laryngeal structures. So the two groups of intrinsic laryngeal muscles. So the first one are muscles that help cause rotation of the cricothyroid joint, adjusting the length of the vocal folds, which are these guys, help alter pitch. So those would include your CT, which is the cricothyroid, and your TA, which is the thyroarytenoid. And then the second group are muscles that cause rotation and translation of the arytenoids, which are these little blue guys, adjusting the position of the vocal folds, which is the white piece. So this helps alter abduction and adduction, which we talked about, the opening and closing of the vocal folds. So this would include your PCA, which are posterior cricoarytenoid, your LCA, which is your lateral cricoarytenoid, and your IA, which is inner arytenoid. So some muscles are your extrinsic laryngeal muscles. These are responsible for larger laryngeal movements like elevation and depression of the larynx. So then your vocal folds, which is this white piece. The membranous vocal folds is the anterior 2/3, so it's going to be the inner part, which are comprised of 5 layers. And then your cartilaginous vocal folds, which is the outer 1/3. So your posterior cricoarytenoid, your PCA, which are these light blue pieces right here, it originates on the posterior surface of the cricoid lamina. It courses upward and forward to insert in the muscular process of the arytenoids and rotates the muscular process of the arytenoid cartilage, which help abduct the vocal folds, which is open the vocal folds. And then you have your LCA, which is your lateral cricoarytenoid, and these are these yellow pieces right here. They originate on the upper border of the anterior lateral arch of the cricoid cartilage. They course upward and downward to insert into the muscular process of the arytenoid cartilage. So these help adduct the vocal fold, which adduct is to close the vocal folds. And then you also have your oblique fibers, which are the orange and green pieces. And the orange piece, the oblique fibers have the origin in the posterior surface of the arytenoid cartilage. They course diagonally to insert near the tip of the opposite arytenoid cartilage. And so then your transverse fibers, which is the green, the transverse fibers have their origin on the lateral and posterior surface of the arytenoid cartilages, so they course horizontally to insert into the lateral and posterior surface of the opposite arytenoid cartilage. And so these fibers are a part of the inner arytenoids, which adduct the arytenoids, which is to close them. They close the posterior glottis, adduct the membranous vocal folds, which is the inner two-thirds, shorten, thicken, and also slacken the vocal folds. Thanks so much for watching, and I hope this helped.